Welcome back, Holistretch family, to a Holistretch video. My name is Frances Eve, and I am showing you an assisted stretch for full body renewal. So in this video, you will get to observe an assisted stretch, and this is also a video where you can learn how to work on a client or a partner or a friend. If you have not subscribed to the channel yet, then please do below. There are many videos on my channel, including stretch and massage for therapists and non-therapists alike. So welcome, and let's begin. So my friend Austin has a very tight back and tight hamstrings, and he wanted to just feel better and feel loose in his body. So what we're going to start to do is we're going to soften up the fascia by using hand motions, pressing the palms into the fascia very easily, nice and gently, softly, allowing it to sink and melt. So when we first work on a client or a friend, even if they trust us inherently, maybe their bodies don't quite trust our body yet. So we need to work slowly, gently. And with this spinal flex, what we're doing is we're stretching the fascia along the spine. And so we can do that by pressing on the top and the bottom and just opening the layers of the fascia in order for the spine to slowly relax and let go, and the body to slowly relax and trust. Always using body weight as leverage and breath as an engine to keep moving forward. We work in a flow space, a flow state. By softening the fascia, we allow the joints to move freely in the body. We can use a repatterning technique where we just rock the body side to side. This is like when you're a baby, you get rocked. This helps the body to come back into homeostasis, relax, find balance. We're going to start to work our way towards the sacrum. So we've softened up the upper back, lower back. Now we're going to get down even lower. Pressing the hands on the sacrum, we start to release the low back. We can bring the hands, the palms, up the sides of the spine, right, left. Nice and gently melting into the erector spinae. Sinking and melting, working the way all the way up to the shoulders. Now we separate the shoulders from the neck by gently pulling on the shoulders. So we want to bring the palms of the hands to the shoulders and gently using our body weight to pull back. Using the thumbs to dig a little bit deeper onto the sides of the spinal tissue, separating, releasing, relaxing, softening, letting the traps melt, and working both sides, putting extra pressure on the left and on the right. I like to start with the left. The left is the receiving side of the body. So we open up the left. It makes it easier for the right to open up also. Releasing tension and knots from the upper back. Oftentimes the traps get super tight from leaning forward on a computer, those who are on a computer, those who drive a lot, sitting in a car, all of that can put a lot of pressure on the upper back. So a lot of people have pressure on the upper back. And when we release tension in the shoulders, it just starts to open up the rest of the body, Remember that the traps are just the other side of the heart, really. So when we open up the back in this way, we allow the heart to open up and give permission for the rest of the body to relax. And we can rock the hips. And if we notice that the glutes are tight, bring the olecranon to the glute muscle, so right under the ASIS. You want to gently use your body weight to press into the glute. Now you can use the upper part of your elbow to acupressure into the knot or any tension to start to release it by pulling the body forward and back, using your body weight and your body pressure to release tension in their glute muscles. You can gently melt deep into the tissue with the elbow, or you can make circular motions. And of course, the rocking can be applied here as well, loosening up fascia, stretching it out, releasing. And we'll go to the other side of the glute. We want to rock in, release pressure, tension. So working their other glute now. When people have low back tension, it's often because their glutes are really tight. Also, of course, runners and people who sit a long time can also have tight glutes. But really what it can lead to is tension in the low back, because it ends up sort of pulling on the QL, the quadratus lumborum muscles. And then when our psoas muscles are tight, we can dig into the psoas a little bit from the back here, just like so. And by pressing into the joint. When our psoas muscles are tight, they also pull on the low back. So trying to release them is really beneficial. We're going to go ahead and turn the client over now and work on some stretches. So to get into the hamstrings, generally I like to start with a bent leg forward. And you can bring the foot to the chest, leaning your body weight forward. And continuing to breathe and just gently let your body weight fall forward. This is really good. And go ahead and gently have them activate the muscle by kicking back into you. So pressing back into your chest. This helps activate the muscle, contracting the hamstring. And now for him, what we're going to do is we're going to open up the hamstring gently. So he's going to go ahead and squeeze the heel down towards the hip, and we're going to lift up that leg. So this is really good for clients and friends who have very tight hamstrings where they can't necessarily straighten the leg all the way perpendicular. So we want to open up the muscles behind the knee. I'm going to go ahead and have one hand on the heel and one hand on the knee. Have them squeeze in as you pull up. So there is resistance here. He's pulling the leg in as he's pulling it and pulling up. So we're not fighting. It's not like tug of war or any of that kind of thing. It's really a forward and backward motion. So when they're squeezing in and you're pulling up, that's when they slowly release it. And go ahead and lift the leg a little bit out of that hip joint there. And then we'll see how far we can go with that straight leg. Go ahead and have them flex their foot and kick down. And as they kick down, you can lift the body back up. Have them kick down and then lift them back up. So they're contracting the hamstring here as you're lifting up. This is really a deep opening for the hamstring, the sciatic nerve as well. So if people have sciatica, it can lead to tension all the way up and down the leg into the glute and the low back. So this will help relieve all of that. Have them press down and then bring your body weight up to lip up. So he has some damage in his knee and some past injuries in his knees. So making sure the knees feel safe is really important. Cupping the knees, protecting them. And then we'll go ahead and bring the hands up to the foot and have them point the foot into your hand and then gently release. This opens up the calf muscle on a much deeper level. And just have them breathe into the hamstring here. Keeping that knee nice and safe and protected. And trying different angles, adducting and abducting the leg. Having them flex and point the foot. We'll get into different angles in the shin, the lower leg, behind the knee. And you'll notice where to go. You'll notice if your client is clenching or breathing deeper. Stay in communication. There are so many subtle ways that we communicate with our clients and our friends and our partners and anyone really. These subtle ways are energetically, through breath, through eye contact, through body language, just being really, really sensitive and aware. We're going to melt the leg forward all the way, letting him melt that hip down, and then kicking back up. Very nice. Now we're going to move into the tensor fascia lata stretch. So moving that left leg underneath the right, and go ahead and bring that left foot to the hip as leverage, and then sliding our left arm underneath their right knee. So this creates a position where the TFL gets really deep stretch and even makes its way up to the hip joint and the low back. And all alongside that IT band too. To add resistance here, we're going to just have them kick out against the hip and then press the hip back in. You'll see it a little better on the other side, but they're just pressing the leg open towards you, and then you're going to push it gently back towards them. Very nice. Then we're going to work the right leg. Notice again how we started with the left side. Now we're working our way to the right side. Starting with that bent knee. Seeing how far we have here. We always want to gauge the flexibility at first, and then it's nice to gauge again and see the difference that we've made in a session. So we're allowing the body weight to come forward onto that foot on the chest, and then have them gently push you away. This activates that hamstring. Nice, straightening the leg, pulling it out of the joint. Keeping the knee protected and safe. We're going to open up the hamstring with bent knee once again. So there are different ways for you to do this. You don't have to do it in this crazy squat, but sometimes I prefer to do it, especially if the knee needs extra attention. If the knee needs extra attention, I give it extra attention, and I use my body this way with the squatting and lifting. You can also do this with the foot on the shoulder and lifting the body up. But because he needed a little extra support, this position helped the best. And so you're squeezing and lifting up, creating that resistance to open up behind the knee. Very good. Starting to straighten that leg and move it out of the hip joint. Lifting up, seeing where we're at, and having them press down as you push up. Making sure that your client is still taking deep breaths as they stretch, and also that you yourself are breathing. This helps the bodies stay working together and synchronized. Go ahead and have them flex the foot and point. Pointing and flexing will help deepen the stretch in the gastrocnemius and the soleus. Breathing. And And now we're going to go ahead and just melt it down. So just allow them to relax the hip. Sometimes I like to pin the opposite leg down with my foot, because if they're super tight, that other leg starts to lift up. So you want to pin it down. Now they're getting the full length of the stretch. And only go so far down as to how they're allowing you to melt down. If it's feeling super tight, just stay there. Getting into the TFL, left leg over right, bringing the hip to the back of that foot. And then they can push open and you'll see it better on this side. But what we're going to do is add resistance here. And the foot comes out, and then the hips bring it back in. This is a deep stretch for the TFL, tensor fascia lata, and also the psoas muscles and the IT band. I mean, you're getting a lot of stretches on the lateral side of the leg and the body this way. Coming back. We're going to go ahead and get into the hip. So bending that leg, the left leg, and keeping it perpendicular to the body, you're going to go ahead and let it rest on your thigh. So generally I have the top of the foot resting on my knee, or my ankle resting on my knee with the foot in my hand, depending on their flexibility level. But to open it up, if they don't have very much flexibility here, you want to have them open up the knee by pressing the foot into you and then you pushing it back in. So pushing it out and pushing it back in. This is creating some wiggle room in the knee joint and just helps them gain more flexibility in the hip as well. Gotta go ahead and lean forward with that knee, opening the hip, and then have them push their knee out as you bring the body weight down by pushing the knee out, and then your body weight falls forward. I generally like to do around 4 or 5 times. Depends on the client and their flexibility and your time and all of that, but generally around 4 or 5 times seems to do the trick. Opening that hip, sometimes a little pressure on the hip bone can help release the muscles right by the ischial tuberosity. We're going to open up the psoas by lifting the right leg over the left, and then pulling over open to the side. So one hand is on the ASIS, or the hip joint, and this opens up the hip flexors and the psoas muscles. It's also really nice for low back issues. Going to the other side now, we're going to start working out that hip. Bending the knee, bringing it perpendicular, resting the heel on the knee or into the hand. And if their knee doesn't twist very easily, then we want to take it nice and gradual. So we want to create a little twist by them pressing their foot into you and then you pushing the foot back, rotating towards them. So we're opening the hips. And leaving your body weight come forward. And then have them push their knee out and come back in. And always when they're pushing out, you want them to inhale, and when the stretch comes in, you want to exhale. You always want to exhale on the deepest part of the stretch. This just helps the body to relax and accept and surrender and melt. Nice deep breaths, opening the space in the hip. And pulling it back around. We're going to go ahead and work this other side. This time left leg over right, and then hand onto the hip flexor, pulling the legs over, opening the psoas, opening that flexor. If you guys are ever in the Los Angeles area, you're welcome to come see me. I am located in Venice Beach, and I work on my clients there. And I'm also working on creating an online course for teachers. So let me know in the comments below if you want to learn some of these tools and techniques. So what we're doing here is I like to bring the hands to the spine and the muscles along the spine, like the erector spinae, just to notice if there's a balance, there's evenness. And if there's not, I work one side more than the other until they're even, if that makes sense. To open up the inner thighs, have them come into butterfly and squeeze the knees up towards you, and then use your body weight to gently press down. Inhale, squeezing up, and exhale down. Thank you guys so much for joining me in the video. Please give it a like if you enjoyed it. And yeah, let me know what you'd like to see in the future. I'd love to make more videos like this. Thank you guys. Have a wonderful day. Feel free.